Testing, testing, 1, 2, 3, testing. Testing, testing, 1, 2, 3, audio check. Test, testing, testing, 1, 2, 3, test.
voices. All right. Sound good? Okay. Start whenever?
You're good to go.
Okay. Uh-oh. Something said there's a connection issue. Interesting. Okay. You should be fine. Shouldn't be connected. Shouldn't be. Okay. All right. Good afternoon, and thank you for all for joining today. This will be our last briefing before the Thanksgiving holiday. Today, I share the latest information on COVID-19, RSV, and flu, and my presentation will be followed by an update on monkeypox from Chief Medical Director for the Los Angeles County Department of Public Health, Dr. Rita Singal. As we move into the winter months, changes in transmission rates of COVID-19 are expected. This is what we've seen over the last few years with COVID. And today I'll cover what our current trend lines and early alert metrics are telling us, as well as updated information on influenza and RSV trends. I'll close with recommendations for safely celebrating this fall and winter holidays. If we can take the first slide, please. As we note each week, this slide shows updated trend lines for the 7-day average cases, hospital admissions, and deaths in LA County. In this figure, the green line shows the 7-day average of the number of cases reported daily and is measured using the vertical axis on the left. During the past week, an average of nearly 1,500 cases were reported per day, a 13% increase from the 7-day average of 1,300 cases reported per day last week, and a 52% increase since November 1st. While reported cases represent only a portion of those infected, since they don't include home tests or people who do not test, we still pay attention to this trend line as it alerts us to patterns in transmission. As we've seen in the past, with rising case counts, we also see an increase in the average number of daily hospital admissions, shown here by the orange line. This past week, there was an average of 97 admissions per day, a 26% increase from the 77 admissions per day last week. Hospital admissions have increased 54% since November 1st. The higher rate of recent increases in hospital admissions when compared with cases likely reflects the undercount of positive cases using lab-reported data. The blue line on this slide shows the 7-day average number of deaths reported daily and is measured by the axis on the right. We're currently reporting an average of 8 deaths per day, slightly lower than the average of 10 to 12 deaths reported earlier this fall. However, since deaths are a lagging indicator, we are concerned that these numbers could rise a few weeks from now, as they have in the past. The impact of COVID is great, not only in terms of illness and individuals impacted, but also in terms of communities changed and lives lost. I send my condolences to everyone who has experienced loss, including families who do not have loved ones at their table during this meaningful time of year. Using the CDC's community levels framework, LA County continues to remain in the low community level. With that being said, over the past week, we continue to see increases across all 3 indicators. Both hospitalization metrics increased slightly this week. The admission rate increased from 5.2 to 5.9 admissions per 100,000 individuals. The proportion of staffed inpatient beds occupied by COVID-19 patients also increased slightly from 2.5% to 3%. This is the 3rd straight week of small increases in these hospital metrics. The metrics are still well below the threshold that would move LA County into the medium community level. However, it's important to continue to be aware of the potential impact that hospitals are seeing with elevated transmission of COVID-19. Our case rate is now 100 new cases per 100,000 individuals, up from 86 cases per 100,000 a week ago. This case rate represents elevated transmission in LA County, and in accordance with the LA County COVID response plan and following updated guidance that the state of California issued in September, indoor masking is, as it has been in the past during times of elevated transmission, strongly recommended for all individuals. This means that now it is strongly recommended that all individuals wear a high-quality mask that fits well in the following settings: in public indoor spaces, when using public transit, including buses, ride shares, taxis, and medical transport, correctional and detention facilities, and homeless and emergency shelters. Masking continues to be required for people who have been exposed to COVID-19 during the past 10 days in healthcare settings and congregate care settings, and congregate care facilities rather, and anywhere where it is required by the site. The county's COVID-19 response plan has been updated to align universal masking on transit and in transportation hubs with recommendations for the public. We note, however, that a recent Supreme Court ruling allows the federal government to consider requiring masking on public transit when transmission is elevated, and we are therefore prepared to align county protection measures with any forthcoming federal requirements. LA County consistently monitors 8 early alert signals to better understand potential changes in COVID-19 transmission. First, of the 4 indicators this week that are classified as low concern, I want to take a moment to take a look at the number of worksite cluster reports in the past 7 days. While the current value of 92 is still well below the threshold of 150 that would move this indicator to medium concern, last week the value was 62, and the week before it was 52. These rapid increases likely indicate that this indicator will soon move to medium concern. 3 metrics are of medium concern this week: the percent of emergency visits for COVID-19, the SARS-CoV-2 wastewater concentration, and the number of new outbreaks in skilled nursing facilities. The 7-day average of the percent of emergency department encounters classified as COVID-19 remains at 5%. With multiple respiratory illnesses currently at high levels, we want to stay aware of how any increases in COVID cases that can contribute to the strain on our healthcare system. After being of high concern last week, the number of new outbreaks in skilled nursing facilities over the past 7 days is now at 16, dropping to within the threshold for medium concern. Continued efforts are still needed to increase the uptake of the bivalent booster in this setting. Currently, about 50% of all residents and 38% of all staff in skilled nursing facilities have the updated booster, and with elevated case rates, as it is essential to get these numbers higher. One indicator this week is of high concern: the percent of specimens sequenced that are of a new subvariant of interest, currently tracking BQ1 and BQ1.1 combined, is at 26%, surpassing the threshold for high concern. This is only the 2nd week of tracking these particular subvariants, and last week this indicator was at 17%. Now, we are paying attention to the significant role that emerging variants and subvariants of the SARS-CoV-2 virus have had in driving past surges, and what the impact may be currently on elevated case rates. The most recently available data shows that the Omicron BA.5 continues to be the dominant subvariant, indicated by the red bars. Yet each week, it is accounting for a smaller proportion of samples. For the week ending October 29th, just over 50% of sequenced specimens were BA.5. This is a significant decrease from the 82% seen at the beginning of October, a strong indicator that some of the newly circulating variants may have an advantage to outcompete BA.5. BQ1 and BQ1.1, sublineages of BA.5, are indicated by the light purple and pink bars at the top of the graph, substantially increased in the most recent weeks. On October 1st, these sublineages accounted for less than 2% of sequenced specimens. Within 1 month, that number increased to 26% reported in our early alert metric. The blue bar on the chart shows BF.7, also a descendant of BA.5. For about 6 weeks, BF7 was growing steadily, but for the week ending October 29th, the number of BF.7 specimens decreased by about 1%. This is further evidence that the BQ lineages appear to have a growth advantage. The bright pink section of the bar represents BA.5.2.6. With the overall prevalence of this sublineage is low, it has increased from just over 1% to nearly 3% in the most recent weeks. It doesn't appear to be increasing rapidly so far, but it does have a spike mutation that may make the sublineage more evasive to antibodies. New to the slide this week, we're now showing BN.1, a sublineage of BA.2.75.5. As of October, this strain accounts for about 1% of sequenced specimens in LA County. As a reminder, we add new sublineages to this slide when the CDC adds the sublineage to their variant tracking website, which typically happens when the sublineage reaches 1% prevalence. For specimens to be sequenced and reported to public health, the local data shown on this slide always has a 2 to 3 week lag. CDC's national data has the same lag, but they're able to calculate predictions of the estimated proportion of each subvariant circulating now. These estimates show that BQ1 and BQ1.1 are projected to continue to increase rapidly. CDC predicts that for the week ending November 12th, BQ1 and BQ1.1 combined will account for about 45% of sequenced specimens nationwide. And this prediction is the same for Region 9, which includes California, in addition to Arizona, Hawaii, Nevada, and U.S. territories. It's important to remember that respiratory viruses are always evolving, and this evolution will naturally create new sublineages that are able to evade some prior immunity. This means that even if you've gotten COVID before, it's still important to take common sense precautions, like wearing a mask when transmission is high, to protect yourself and your loved ones. Getting the updated booster can also offer in October and runs through September of the following year. On this graph, you can see the months along the bottom, and the axis on the left represents the percentage of specimens testing positive for flu. This week, we identified an issue with the data we received from one of the largest participating labs. We have since received revised data from them, and the positivity values for the 2022-2023 season, shown in the red line, have been revised. I'll note that these revised values are different from the LA County Flu Watch report that was previously published, as we just received the updated data this morning, and we will be correcting the data in the Flu Watch when we issue the report later this week. Although the specific positivity rates have been updated, the trend remains the same. We are seeing steep increases in flu positivity. For the week ending November 5th, 15% of respiratory specimens at Sentinel Labs tested positive for flu. This is nearly double the 8% positivity seen the week prior. I want to remind everyone that flu data is inherently different from the COVID data we're used to seeing, since labs are not mandated to report individual flu tests to public health like they are for COVID. This means that flu data is more subject to change, and that is a normal part of flu surveillance. This means that while the exact positivity values are subject to change as data is cleaned and refined, the overall trends provide us with important information on transmission. Here in LA County, it's abundantly clear that we are seeing high levels of flu activity for this time of year, and we're continuing to see a sharp increase in the proportion of specimens testing positive for flu. Since any cases of influenza can be severe, especially when it spreads to people who are at high risk, including older adults and young children, and the reality that in LA County we have an elevated number of infected individuals who can transmit flu to others. It remains very prudent to go ahead and get the flu vaccine now if you haven't done so already. Next slide, please. The data quality issue described on the last slide applies to RSV as well. But unfortunately, we have not yet received updated data on RSV from the lab in question. Data from this particular lab has been removed from the 2022-2023 trend line on this slide, and we are actively working to get revised data from the lab, and we will update this graph when the revised information is available. In the meantime, the exclusion of this lab caused the exact percent positivity values to change, so we'll focus instead on the overall trends. You can see that even with the adjustment, RSV positivity is still extremely high, surpassing the peak rates seen over the past 4 seasons. The dip in cases shown on this graph may be an artifact of both the data quality issue described previously and significant increases in testing volume for RSV in the recent weeks. It's too soon to tell if this will be a sustained decline, but the trend will become more clear as we receive additional data. The increasingly high levels of RSV activity, especially this early in the season, warrants caution. RSV often impacts young children most severely and causes bronchiolitis and pneumonia. It's important to take precautions to prevent respiratory illness, including washing hands often and wiping down frequently touched surfaces. Also, know that masks will provide protection against RSV and flu the same way they provide protection against COVID transmission. Next slide, please. With levels of flu and RSV activity, especially in children, we're also keeping watch on pediatric hospital capacity. Here we show the 7-day averages for the percentage of pediatric hospital beds occupied from June of 2021 to November 15th of 2022. The blue line shows the percentage of staff pediatric ICU beds occupied across LA County. This number tends to be around 50 to 70%. The yellow line shows the percentage of all staff non-surge pediatric beds that are occupied across LA County. Non-surge beds simply refers to staff beds being used when the hospital is at its regular operational level and excludes any extra beds that a hospital may set up during surges. You can see on the graphs that occupancy percentages are trending upwards. The 7-day average for the percentage of non-surge beds occupied is currently at 64%, the highest point shown on this graph. Although this percentage is increasing, it is not currently increasing at a very fast pace. On November 1st, for comparison, the average occupancy percentage for pediatric non-surge beds was 60%, not far off from the current 64%. Occupancy of pediatric ICU beds has been increasing at a slightly faster pace. On November 1st, an average of 67% of pediatric ICU beds were occupied, rising to 75% by November 15th. Again, this is the highest occupancy percentage for pediatric ICU beds seen over the 17 months shown on this slide. These increases in pediatric bed occupancy are concerning, especially given the fact that we are still early in the typical respiratory virus season. These numbers do not translate to a dire situation at hospitals at this time, but we are already hearing anecdotally that hospitals and healthcare workers are feeling stress. It is important to note, while this metric is reported as a percentage, many hospitals have only a small number of pediatric beds, meaning that just a small number of new pediatric hospitalizations have the potential to put a hospital at capacity. Next slide, please. On this slide, we see similar data for total ICU beds and non-surge beds in LA County. The total occupancy of non-surge beds is at 77%, and the occupancy for ICU beds is at 68%. Last winter, near the end of January, the ICU bed occupancy rate was 73%, and the system was stressed. These higher than anticipated hospital occupancy rates are seen across all parts of the state. As a result, the California Department of Public Health at the state has issued a bulletin asking all hospitals to be prepared for a possible surge by securing supply chains, anticipating and addressing staffing challenges, and taking advantage of flexibilities still permitted under the state's emergency declaration. As individuals living in communities with high circulation of multiple respiratory viruses, each of us can take steps to help prevent hospitalization and severe illness. In addition to following masking recommendations, the updated COVID-19 bivalent booster is widely available in LA County and can help prevent hospitalization and severe disease. With elevated case rates, higher occupancy rates in hospitals, and a lot of respiratory illness circulating, I want to reiterate the effectiveness of and importance of a high-quality mask that fits well. Last week, researchers out of Harvard published a study looking at COVID-19 cases in students and school staff across 72 school districts after Massachusetts lifted its statewide mask order on February 28th of 2022. There were school districts that lifted masking immediately in the first week following the announcement. Others ended masking during the second and third week after the order was removed, and other school districts sustained masking. Researchers looked at COVID cases per 1,000 people for 15 weeks following the end of the state order. Across all districts for the 15-week period following the lifting of the masking order, there were 40,416 cases of COVID, about 120 cases per 1,000 people. Districts that maintained masking reported 66 cases per 1,000 people. This school study is unique. It's one of the first times that we've been able to observe directly the impact of masking. The study authors noted that the effect of school masking policies was greatest during the weeks when the background incidences of COVID-19 in the surrounding cities and towns were highest, a finding that suggests that universal masking policies may be most effective when they are implemented before and throughout periods of high COVID-19 transmission. It's reasonable to assume that the effectiveness of masking demonstrated in this study is relevant in non-school settings as well. Next slide, please. In winter, we find ourselves indoors more often, at entertainment venues, holiday gatherings, shopping for gifts, all situations that can increase exposure to COVID-19 and other respiratory viruses, especially if you're not wearing a mask. This slide shows the probability that one or more persons is infected with COVID-19 if you're at an event or an indoor space with 200 people. This could be something like a movie theater, a popular restaurant, or an indoor ice skating. If the current case rate in LA County is 50 cases per 100,000, there is a 25 to 35% chance that someone at a 200-person event has COVID. For the current case rate in LA County, near 100 cases per 100,000 people, this jumps to a 45 to 60% chance. If the case rate continues to increase to 150 cases per 100,000, the probability that one person is infected with COVID-19 in a room of 200 increases to 60 to 75%. There are high probabilities that you will be exposed to someone with COVID, and the chance increases significantly as the case rate increases. Wearing a mask indoors can help decrease the chance that COVID spreads to you, and subsequently to those around you. Next slide, please. Next week, many of us will be celebrating Thanksgiving and gathering with friends and family over the long weekend. We are grateful this year to have the tools that allow us to gather with a lot of safety. It will mean, however, that all of us are likely to need to take some common sense precautions to avoid future disruptions and the spread of illness. First, we should all do our best to be sure we are up to date on our vaccinations. The flu shot and the COVID-19 updated bivalent booster are both widely available in LA County, and you can receive both vaccines at the same time. I realize that many people are thinking that it's too late to get vaccinated before Thanksgiving because the vaccines need time to be effective. While protection does ramp up over 1 to 2 weeks after you are vaccinated, this doesn't mean that you will have zero protection until this point. You still have some protection, and you will be prepared for future events. Most pharmacies have these vaccines readily available without appointment, and you can visit ph.lacounty.gov /how-to-get-vaccinated to find a site near you. Testing is also an important before gathering. If you are hosting, consider asking guests to take a home test before they come over. If you're going to a gathering and you know that there will be older people or people who are at high risk for severe illness if they get infected with COVID, test before you arrive just to be safe and ensure that you are not passing along anything that you don't want to be doing in terms of passing illness. COVID-19 home tests from the pharmacy may be covered by your insurance, so please note that as well. If you are sick, please stay home. If you are coughing, sneezing, have a runny nose, a fever, or other concerning symptoms, it's not worth the risk you could infect others. I realize that more than anything, we want the sense of normalcy that comes with being together during the holidays. However, even a scratchy throat could result in passing along a respiratory virus. Stay at home, rest, and recover. As a last step to a safe gathering, look for ways that you can improve ventilation in your home. If it is not too cold, stay outdoors as much as possible. When inside, open windows or screen doors and use fans to move the air. If you have an HVAC system in your home, set the fan to on and make sure that your filters are installed properly. You can also use a portable high-efficiency air cleaners. You may also hear them called HEPA air filters or air purifiers. Improving ventilation in your home as well as gathering in larger rooms where people are spaced apart and going outside if possible can help reduce transmission of airborne illnesses. I, like many of you, look forward to gathering and celebrating this Thanksgiving, a time when we can make new memories, enjoy each other's company, and feel secure in the fact that we have the tools and knowledge to gather safely. With this being said, cases are rising, new variants are emerging, and there is concern about hospitals reaching capacity. I encourage everyone to use this information as a reminder that we need to take advantage of the resources that we have and use layered protections to have a safe holiday. Now I'll turn it over to Dr. Singhal to provide an update on monkeypox, and we'll take questions after her presentation.
Thank you so much, Dr. Davis. All right. Okay, good afternoon. So I will start with a situational update of the monkeypox outbreak and what we are currently seeing with cases and deaths here in LA County, nationally, and worldwide. Take the first case. There have been over 80,000 monkeypox cases across the world associated with this outbreak and 38 deaths in non-endemic countries. In the United States, total reported cases are about 29,000, and there have been 11 deaths reported. As of today, there have been 2,221 cases reported in LA County, 123 reported in the city of Long Beach, and 30 reported in the city of Pasadena. We have confirmed a second death of a person due to monkeypox in LA County. To protect confidentiality and privacy, additional information will not be made public. We send our deepest condolences to the family members, friends, and others who are mourning the loss of their loved one. As mentioned earlier, there have been a number of deaths attributed to monkeypox globally and nationally. Although most people with monkeypox have mild to moderate illness and hospitalization rates have remained low, those that are severely immunocompromised are at risk for serious illness and death. Given this risk, we are reminding persons with monkeypox who are severely immunocompromised, including having advanced or uncontrolled HIV, to seek medical care and treatment early and remain under the care of a provider throughout the course of their disease. Healthcare providers who are asked to report and to consult with public health regarding any patients who are hospitalized with monkeypox, especially patients who have worsening disease. Next slide. Our latest monkeypox case trend data by episode date is shown here on our EPI curve. The blue bars indicate daily case numbers, and the pink trend line indicates the 7-day average daily cases. As you can see, there continues to be a substantial decline in monkeypox cases. As of November 5th, our 7-day average daily cases dropped to just 3 cases per day, compared to a 7-day average daily cases of 5 1 month ago and 20 daily cases 2 months ago. In addition, I'm happy to announce that Tuesday of this week was our first day with 0 new cases reported in LA County since early June, when the monkeypox outbreak began. And since Monday, we have had only 1 newly reported monkeypox case. We are encouraged by these declines, and as I will discuss in a moment, we continue to work with partners to ensure that residents have access to timely and accurate monkeypox information, as well as vaccinations and treatments. Next slide. Vaccinations continue to be a key preventive measure that can protect individuals and help to slow the spread of monkeypox in LA County. In LA County, over 112,000 doses of the JYNNEOS vaccine have been administered, and 57% of those who are eligible have received their second dose, completing the series. While vaccination activity is slowing, with the help of many healthcare providers and community partners, we continue to administer vaccine and are specifically working to ensure individuals living with HIV and other groups at high risk for serious illness are vaccinated. Next slide. We are pleased to see that monkeypox cases continue to decline, and as we move into this period of lower transmission, we remain focused on 4 key strategies that can help prevent future cases and move us towards no local transmission of monkeypox in LA County. First, we are continuing to work with partners to ensure that residents have ready access to testing and to the antiviral treatment tecovirimat, also known as TPOXX, which is recommended for people with severe monkeypox disease and those who are at high risk of severe disease. Next, as noted, vaccinations remain critical to our efforts to prevent monkeypox. Although, as mentioned, the pace of vaccination has slowed, we continue to see progress in our vaccination coverage. It's difficult to calculate vaccination coverage rates due to the varying estimates of the number of residents who are at risk for infection. However, we estimate that between 45% and 65% of at-risk individuals have received at least 1 dose of the JYNNEOS vaccine, which is very reassuring at this point in the outbreak. To ensure access for those at risk, we've maintained a strong network of vaccine providers, with vaccinations being offered at over 100 sites across LA County. To encourage more residents to start and finish the 2-dose vaccine series, we are addressing barriers to vaccination. For instance, while the intradermal method is being used to vaccinate most people ages 18 and older, Residents who have a concern for keloid scarring or who strongly prefer getting the vaccine subcutaneously can do so and should let the vaccine provider know of their preference. Throughout the outbreak, partner and stakeholder engagement has been key to our efforts to raise awareness, reach at-risk communities, and increase testing, treatment, and vaccination for eligible individuals. We continue to actively engage partners from various sectors in our response by integrating their input and feedback into our outreach strategies, messages, and communications materials, providing regular updates on new developments, and sharing resources. Finally, effective messaging and educational materials remain core to our ongoing response. To increase awareness and ensure eligible residents know how to access vaccinations, testing, and treatment, we regularly update a variety of educational materials available in multiple languages on our monkeypox website, and we message through various social media platforms and paid advertisements. Residents, providers, and partners can visit our monkeypox website at ph.lacounty.gov/monkeypox to access these resources, view the latest monkeypox data, and learn about options for getting vaccinated, tested, or treated. Residents can also call the DPH call center at 833-540-0473 for information and to be linked with resources. Thank you.
Send in a few questions as well. The first question for you, Dr. Davis, was sent in by Marla Tejas from Fox 11 News. She asks, if we hit the high community level, how will the department respond? Do you foresee a mask mandate?
It's a great question, and it's actually spelled out in our COVID-19 response plan. Like the CDC has recommended that communities that are at the high community level, that everyone should be wearing masking. We have listed that in our plan in terms of going back to that if needed, but it would also mean that we would have indicators in terms of the hospital metrics would also be high as well, and must be high for a 2-week period consistently. So that is spelled out in our plan, and at this current time, that's what we'll follow. As we go through, we'll always look at our plan and update as needed based on what we're seeing. But that's currently what we have planned at the moment.
Another question from Joy Benedict at CBS 2 KCAL 9. She asks, how are our vaccination rates with the new bivalent booster? Are things still slow?
Relatively to where we would want to be, we have about 13.7% or about 14% of the population who are eligible from 5 and older who have received the updated bivalent booster. Again, we'd like that number to be much higher than what we're seeing right now, especially before we get further into this winter season. So we continue to have our efforts out in the community, providing education, updating residents about the bivalent booster and who is eligible to receive it at this time.
We have a follow-up from Marla Tejas at Fox 11 asking if we have any projections to show us when we may be hitting the high community level.
That's a good question. We don't have projections on that. I mean, as I mentioned, our hospital metrics, which are really what determines whether or not we reach the high community level in accordance with the CDC framework, have been going up slowly, but we are far from even the measure that would get us into the medium community level. So at the moment, we don't have any predictions as to when we might hit that. And again, this is really determined by those hospital metrics.
One question sent in from Luke Money at the LA Times. Does the county have any data on how many residents have gotten the flu vaccine so far?
That's a good question. I don't have that information at the moment, but I'm sure we have it. We'll have to get back on that.
Anything in the room? No? All right. I think that's it.
Okay.
Great. Thank you.